Because we've become much more aware of dementia, and we've been reviewing many more people with dementia, or looking for people with dementia, we've discovered many more people with mild cognitive impairment.
Well, I'd become increasingly bothered that I was forgetting things, mainly how to do things that I'd done hundreds, thousands of times before.
Well, I think the first thing, the most important thing is to recognise that there is an issue and to listen to what people have got to say. People know how they feel, they know what they're observing, so it's to take it seriously and not just put it down to age or put it down to circumstances. It's to listen to carers, and I think it's about making an objective assessment of the situation. Then as a GP, following that, what I would probably do is arrange a series of investigations. One of which would be to think about to do some blood tests, because sometimes there are some physical causes of memory impairment. I would probably organise a memory assessment. But then it's also about looking at things like medication, because there are some medications that affect a person's ability to think clearly.
GPs are key to recognising memory problems, as well as making sure that those individuals who have some memory difficulties get referred to the appropriate services, whether that be to local mental health services or memory services. It is important so that at least it gets explored, and then we have a conversation with that individual and the individual's family in terms of what it means for them, as well as planning for the future. As a GP, much of the information I get around mild cognitive impairment I'll get from my local memory assessment clinic. But we have some really proactive charities as well that support this work, and they provide really good services for people with mild cognitive impairment and dementia. So Age UK and the Alzheimer's Society both provide really helpful information.
When a person is diagnosed with mild cognitive impairment, clinicians can refer them on for support to other organisations for anything really that will keep their mind and body active. A walking group, an exercise class, or just a social group really. So
we know with people with mild cognitive impairment, about 10% of people might go on to develop dementia. We're not 100% sure. We think it's about 10%. It could be up to 15% of people. We also know that by identifying these people early and by helping people to change their lifestyle, address things like smoking, alcohol, blood pressure, and also by adapting exercises to promote brain activity, that risk of developing dementia is reduced. As consultant psychiatrists working in a memory service, I do see on a daily basis of individuals with mild memory problems, but I'm certain there are a number out there in the community that do struggle but they haven't been recognised. So I think it's a shared responsibility within both primary and secondary care, and I guess even acute trust to ensure that these individuals are highlighted so that we can follow them up and assess them and support them in the right way. But we also have to be mindful of giving the right diagnosis at the right time.
It almost improved as soon as I knew there was a problem, if that makes sense. It took away the panic and the fear and the worry that there was something wrong.
In Age UK Trafford, we have identified the gap involving people with mild cognitive impairment. So things can be done, and you can help prevent dementia in the long term by supporting people with mild cognitive impairment. New drugs are coming that are likely to prevent or delay the onset of dementia. By people with mild cognitive impairment taking part in research, they are likely to get those drugs.